Hello and welcome to UCL Global Health. A recent article in Nature showed that global health has become the most rapidly growing master's subject in Europe and North America. I'm joined by one of our new global health students, Dr. Annie Reremoi from Kenya. Anne, tell us a little bit about your background.
So I'm a pediatrician from Nairobi, Kenya. I was trained at Aga Khan University Hospital, and I heard about this program from one of my, the director of the hospital. He's actually as online student from this institution, and he came highly recommended that I should be at UCL.
Yeah.
Yes, so I applied for international child health because I'm more interested in issues affecting children, and I also applied for the African Graduate Scholarship, and I was fortunate to be one of the awardees for this award.
Now you had two very inspiring mentors, one of whom actually was one of my heroines, Dr. Ruth and Duarte. Tell us about them.
So both Professor Duarte and Professor Were are my heroes. They've been instrumental in influencing HIV care in pediatrics. Almost all of the students who come out from the training are now trained by them on issues about treatment, care, and feeding practices, which is important because HIV prevalence is quite high in African countries, especially in the sub-Saharan, and they've been involved in breakthrough research on this case or issue. Yeah.
I remember being at the Global Health Council several years ago. Ruth and Duarte gave an after-dinner speech at the big celebration there, and she had everyone in tears. She spoke about her own experiences of the HIV pandemic, and it was profoundly moving, and she's a fantastic researcher. What do you hope to get out of a master's program in international and global health?
So what I would love to be, I think what I say when I grow up, I want to be like Professor Duarte and Professor Were, because what we learn here is how to influence globally. What we are trained as pediatricians is to work one-on-one with the children, but when you work in that situation, you realize that you're not reaching as many people as you would like to, and you're not influencing policies as much as you would have done if you had come to a course like this one. So by being equipped with this course, we then go back home and we're able to be persons of influence. And I think both of them are they go to the parliament and they're able to give the case for certain causes. For example, like the introduction of the rotavirus vaccine,
right,
and the introduction of the pneumococcal vaccine, which has happened thankfully because of their work. This was started last year, and rotavirus we will hopefully get next year. And these two big interventions will save many lives. They'll prevent children from dying from diarrheal diseases and from pneumonia.
So you see yourself as a clinician, a pediatrician,
yes,
also as a public health physician and teacher, maybe an academic,
maybe,
but perhaps also a politician.
Yes, I think that would be how to put it all in one goal.
So when you're Minister of Health in Kenya, you'll come back and talk to us.
Definitely.
Thank you.
Thank you very much.